this video, we are exploring validity, reliability, and assessment data. Think about this. A nursing student passes a clinical skills checkoff with flying colors, but freezes during the next patient encounter. Another student fails a multiple choice test, yet confidently performs the same procedure in a lab. What do these two examples tell us? They tell us that scores alone don't always reflect true ability. Today we'll explore validity, reliability, and how to use assessment data wisely so we can trust the story of our data and what it tells us about student learning and performance. In health professions education, assessment decisions carry real-world weight. A competent rating means someone is ready to treat patients successfully or go out into the field and do what they need to do as prepared individuals. Let's start with understanding reliability. Reliability asks, would we get the same results under similar conditions? Even a valid tool loses meaning if the results are not consistent. Let's start with inter-rater reliability. It asks if different evaluators score similarly. For example, two instructors observing a student's bedside exam should assign comparable ratings. Next is test-retest reliability. This is where we ask if the results are stable over time as more students test and retest. Lastly, we have internal consistency. This is where we ask if all items on a survey measure the same. Reliability improves with clear rubrics, rater training, and standardized procedures. Think of it as a calibration, like ensuring each blood pressure cuff reads the same. Well, let's go ahead and take a moment to think about making sense of our assessment data. Once assessments are valid and reliable, we can interpret assessment data confidently. We look for patterns across these tools. For example, do the quiz scores, reflections, and simulations tell a consistent story? Are there gaps between knowledge and performance? Use data triangulation, which is combining multiple sources, to strengthen your conclusions when it comes to your assessment data. In evaluation terms, one data point is interesting, but 3 tell a story. Let's cover a few common pitfalls. Beware of assuming that those high scores always mean mastery or that low scores may mean failure. Poorly designed assessments can distort the reality around those concepts. In the end, assessment isn't just about the number. It is about the trust in the process, the tools, and the raters and the assessments you created. When our tools and assessments are valid and reliable, our assessments and the data become meaningful evidence of learning competence. Before your next assessment, ask yourself, does this measure what I intend? And would another instructor rate it the same way? That's how we turn scores into insight and insight into better education.